Welcome to Big Butts, No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the show for you today? I very often get asked by my listeners, my followers, my clients, my patients, now that I had my surgery, what can my husband do? Because he's jealous. Now he wants to do something to make himself feel better. And with that, I have a very special guest today, Dr. Joel Pash out of Florida. And we're going to be talking about something that you guys are going to be very interested about, and that is penile enhancement. So, hello, Dr. Pash. Thank you for being on the show.
Hello. Thank you for having me.
I'm super excited to dive into the subject because I think it's super interesting. I know my listeners are going to love listening to it. So why don't you tell us a little bit about yourself and how you got into penile enhancement?
So I'm an anesthesiologist. I have been in anesthesia practice for about 15 years now. About 4 or 5 years ago, I began looking for a way to get kind of out of doing anesthesia full time and into cosmetic medicine. And the obvious or natural way to go is men's health, me being a man. And I kind of figured at the time that women wouldn't want to see a middle-aged kind of balding anesthesiologist. So I decided to go into men's health. Upon looking into that further, I actually just stumbled across this procedure, and it turns out that it was really effective. And so rather than going into the whole thing with Botox and face filler and laser machines and all that, I just went right into this, and we were pretty much successful from day one. And so I didn't find a need to go any further than that. And years later, now I've probably done over 1,000 of these procedures.
Wonderful. So for my listeners who don't know exactly what we're talking about, why don't you tell us a little bit about this actual procedure?
Sure. The procedure is a penis enlargement procedure using dermal fillers. So the fillers we mainly use are hyaluronic acid fillers, which are the same thing that's used in the face. So most commonly used for women to get their lips larger. The procedure is an injectable procedure. It takes about an hour. The main result that patients see is an increase in girth or thickness. There is kind of a secondary result, which can be in certain cases an increase in flaccid length. But the main thing that happens is an increase in flaccid and erect girth and or thickness. Procedure takes about 45 minutes to an hour and 15 minutes or so, depending on how much filler they're getting. It's pretty straightforward. It doesn't really hurt, and it's got a quick recovery.
That sounds amazing. How many cc's do you usually do in a typical procedure?
I would say the minimum is about 6, and just yesterday I did 20. So, and that was pretty much the upper end. The amount that you can put in is a combination of what their starting size is. So obviously if you're starting out huge, then you have more room for filler. So if you're starting out with a 12-inch penis, this is just for illustration purposes. Not that anyone actually has that, but if you did and you put in 2 milliliters, it's not going to do anything. If you have a 1-inch penis, again, for illustration purposes, and you put in 2 milliliters, it might make a huge difference. But generally speaking, 6 to 20.
That sounds about how many usually women have in their face.
Over the whole face, right? Like not one part of.
Not one area, yeah. Right. So when I was looking over your guest form, I saw that one of the things that you really wanted to talk about today was the different complications that can happen when these procedures are done by people who are not skilled at the procedure or shouldn't be doing this procedure.
Okay, yeah. So in the United States, at least, almost anyone can do a medical procedure if you're supervised by a doctor, and in certain states, you don't even have to be supervised by a doctor. So I'm aware of people that are outright not medical practitioners at all that technically, have a doctor that stops by the office sometimes. And so they're supervised and they can do procedures. Of course, you have nurse practitioners, which are perfectly good at using filler, and some of them work on their own and some are supervised. And you have PAs, which is the same thing. And then you have doctors. I think any one of those three can do a perfectly good job. It's up to the patient to kind of determine who they want to go see. The company I own only has doctors doing the procedure. And again, that's not to say that we're better than a very experienced nurse practitioner, but I think we're better at this procedure than most other people, regardless of what their qualifications are. Pretty much anyone that has any qualifications can do the procedure. I would say the main thing you should be looking for is, okay, they're licensed and they're legally allowed to do it, and then beyond that, how many procedures have they done, and what kind of outcomes are they getting? Whether you're having a knee surgery or a spine surgery or a penis surgery or procedure, that's the most important thing, is what the experience is and how many they've done. In terms of penis filler, and this is probably very similar to the face, the main complication that you get when you have someone inexperienced is it just doesn't look very good. It's generally a very safe procedure, and so whether you've done 2 in your whole life or 1,000 in your life, as the medical provider, you're probably not going to have any serious complications, as long as you're moderately skilled. But the issue is the artistry and the intricacies of making it look good. Beyond that, then we have other things that people get done to their penis, which is usually surgeries. And that's a whole different ballgame. The surgeries that are out there are quite invasive, and we see tons of complications from those. That's not to say that they're all dangerous or that everyone has complications, but the patients I see that come to my office that have had surgery usually have not ideal outcomes. And they come to see me so we can fix it using filler.
Interesting. So I'm so curious about the type of what does the typical patient walking through your door, what are their complaints? What's their MO?
Well, there's a few different reasons to come. The most common reason is just plain and simple, just want a bigger penis. It doesn't mean you have a self-esteem issue. It doesn't mean you're too small in the first place. It's just like, I want to have fun, and who doesn't want a bigger penis, right? And so if you can afford it and you're at that stage in your life, then you just come and do it. Just exactly the same as getting breast
Like women.
implants, or right. Like, there's not necessarily a reason. Of course, there's some people that have like self-esteem issues, and we can help with that too, because regardless of why you're coming, we're still giving you a better penis. And then there's, I would say paradoxically, in a certain way, the least common reason someone comes is because they have a small penis. Like, usually it's not that. Again, that's not to say we can't make it bigger if it's small, but most people by definition are average. So most guys just have average size. Maybe they think they're small, but they're not. And we're just making it bigger.
They just want to be bigger. It's so similar to like women with their breast implants, right?
Yeah,
Like
totally.
there's nothing wrong with it. It's fine if they're small, but we just want bigger.
Right. There's very few people that go to the doctor, that go to a plastic surgeon, that for cosmetic stuff, that need the cosmetic thing. It's probably
Exactly.
like 1%, right? Otherwise, it's just
Probably.
all like having fun.
Why is male enhancement growing so quickly? And what risks come with that surge in demand?
Well, I think it's growing quickly because there's uh, a trajectory of once things get known a little bit, then it becomes exponential. 5 years ago, I think this was like a very fringe thing that no one knew about. And then you have maybe in 1 year, like you have 1,000 people doing it the next year, 2,000, then 4,000, then
And it just
16,000 or
keeps
whatever. So it
growing.
keeps going. And that trend is with the men's health space in general. I think that there's a general perception or more of a kind of understanding that men can get things done cosmetically as well. That wasn't the case 10 years ago, let's say. Like, I mean, maybe not. Like now, I have patients that overlap that have had other cosmetic procedures done. And every now and then, I get someone that has had facial filler put in, for example. And I'm sure that 10 years ago that there'd be like zero patients in the office that are men getting facial filler, or maybe even 5 years ago. So that just demonstrates that there's just an understanding that men can get that done. So the risks that come with that is what we've already covered to a certain extent, is just that now anyone that has a med spa can just puts a thing on their website saying that they do penile enhancement. And I can tell you or the listeners that they don't, because I'm one of like 3 people in the United States that trains people how to do it. And I train a lot of people, but I haven't trained every med spa in the country. So I don't know if they learned it from a video or from like word of mouth or something, but there's just no possible way that most places out there are highly skilled in this at this point.
One of the other questions I had here is how do unregulated fillers and DIY enhancement tools cause nerve damage?
So unregulated fillers are not necessarily going to cause complications. But I mean, assuming are we talking about hyaluronic acid fillers that are, for whatever reason, not available in the United States? Those are not going to cause complications per se. They're just illegal to import and to use. And if they're from certain countries, you don't really know like what the manufacturing process was and how pure they are. But, assuming they're kind of otherwise fine, they're probably fine. They're just illegal. Now, when you're talking about unregulated, if you just mean unregulated materials like putting Vaseline in there or like motor oil and stuff like that, I think like people do all kinds of crazy things. And obviously those are going to cause infections and like not ideal results.
Have you seen I'm super curious because there's a trend, right, in cosmetics where they do silicone bipolymer filler that they use. Have you seen people walk through that have had that done for penile enhancement?
I haven't, so I have one patient I can think of that I actually referred to one of our doctors in Canada to do it. But I don't have any patients here that, I mean, besides for that guy, I'm not aware of any patients that have had that done in the United States. And I'll caution listeners to not have it done in the United States because there's no filler like you need probably 100 milliliters of filler to put that in your butt. And there's no filler in the United States available that would make that cost effective. Like you're probably to get 100 milliliters is going to cost you at least $40,000.
I mean bipolymer injections for penile enhancement. Like
Oh,
have you
like putting the
seen
butt filler the same.
the
No,
same?
I haven't heard of that
That's
being used.
good because
Okay.
poor people that have had those butt shots and bipolymer injections years ago, it was kind of like a back alley type of treatment. Now those women who have those shots, that silicone in their butt, are having to pay tons of thousands of dollars to get it removed. And it's something that was really prevalent there was probably like, I don't know, 10, 15 years ago where these new materials came on the market and people were using them everywhere, on the face, in the body, on the butt, in the hips. But it was not something that was actually supposed to be used for those types of things.
I think that's a problem in medicine in general. Like even being an anesthesiologist, it's not uncommon to see people come in for plastic surgery that have had even having routine, like what would be considered a routine plastic surgery in the United States. They go to Guatemala to have it done, or Romania, or some place where it's cheaper. They come back, it just infected or looks horrible or whatever. So that's just a caution with anything, is you kind of get what you pay for a lot of the times. And the reason why things are $15,000 instead of $600 is for a reason.
Definitely. That brings up a point that I was going to ask, which is what's the usual price range for a typical enhancement?
I would say probably the average is like $6,000 or $7,000. Um, that would roughly be 10 milliliters of filler, which is kind of what the average person gets. You can get results from about 6 milliliters, which would be 44,000 ish, and then like on the bigger side is 15 or 20. But most people, if they're like an average size, come in and get 10 milliliters, they'll be thrilled with the results.
So if you're listening and your husband has been hounding you about now he wants to get something done too, and he wants to experiment with cosmetic procedures, we all know the BBL Drizzy saga from last year. So men are definitely wanting to have liposuction, have enhancements, get their face Botox, filler, get everything done because they realize we can do it too. The women are doing it. Why can't we look 10 years younger and better and more enhanced? So the pricing is about the price of a breast augmentation, roughly between 6 to 10,000. So for those men out there considering this procedure, how long would that investment last?
It lasts a little bit longer in the penis than it does in the face. In the layers that we're putting it in, there tends to be a little less blood flow than there is in the lips, or like the face is very vascular in general. So we tell people on average 2 years. There's some range there. Like some people last longer and some last less. I'd be comfortable telling people a 2 year average, but it is not a permanent thing. So it is something that has like ongoing investment, and that's just again like very similar to the face or whatever.
Is there at this point, are there different procedures that are more long term?
There are there's so that in all cases, like there's no filler that's designed for the penis. So we're using face fillers, and so it's all the same products that you see in the face are being put in the penis. So some of the longer acting ones would be PMMA, which is Belafil, and then Sculptra. I don't use those, and the reason I don't use them is because if you do get an imperfection, it's you need surgery to remove it. And the I think that the fillers when they're used in the face is like the way that the penis works is different than the face. The penis shrinks and expands like a lot every day. Like there's a huge range, and so when that happens, there's some possibility of filler causing a lump or a migration or something like that. We have it down pretty good now where that's not very common, but the issue is that if it does happen with hyaluronic acid filler, we can easily dissolve it in 2 seconds and then they're fine. And I've seen like again tons of people that have come to the office with so-called permanent fillers and it just doesn't look good and they're just stuck with it. The other thing is they're not really permanent, right? They're marketed as permanent, but they do probably last 5 years or so. And when they do start wearing off, it's not necessarily wearing off evenly. So even if you started out with a perfect appearance in 4 years, it's probably going to look all off.
For my listeners, you guys don't do permanent filler anywhere, on your face, on your butt, anywhere. Nothing that you're doing other than a actual surgical procedure should be permanent, because I've seen women who have had permanent filler put in maybe 10 years ago, and now their face is completely changed. Their gravity doesn't stop just because you got permanent filler. So gravity is still pulling their face down, and you can see the location of that permanent filler in their face where it got injected, where that's not where their face is anymore because they're aging. So permanent filler, you guys, no, we don't do that. Bella
Yeah, and
fill,
that's
none of those.
interesting that you say that, because it's exactly the same in the penis. And I think that since this is newer for men, and men don't seem to talk about it, like if you're a woman getting filler, you probably have like 20 friends that have got it, and you can get together and decide, someone will tell you, no, don't get permanent or whatever. But guys, that when they contact us, they just want the cheapest thing that lasts the longest. And so a lot of the time it's us trying to convince them that permanent is a bad idea. It's easier, is probably more likely to follow the advice of like a girlfriend in women's case than following the advice of the guy on the phone that's trying to.
Exactly. Well, I'm so happy that we had this conversation today. I feel like I learned a lot. If somebody who's listening to the show wants to come see you or see one of your practices that you have across the country, how can they find you?
They can go to our website, which is upsizematters.com, upsizematters.com. They can, to find a specific doctor, there's a doctor finder menu. Just go on there and choose the city nearest you. If you send a text message or click on the phone us button, you'll get a real actual person in the United States that'll talk to you and explain everything you need to know and help you book an appointment. If you're a doctor that's looking for training, or a nurse or a PA, you can go to our website, which is called Urosculpt, which is urosculpt.com. And there we offer training for different medical practitioners.
Wonderful. I love it. So you guys, you heard it here. If you or anybody in your circle is considering this procedure, you know where to go. And with that, I'll see y'all next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board-certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.